My name is Kinan Kassar, and I'm an interventional and structural cardiologist here at Genesis Healthcare System. So atrial fibrillation is the most common cardiac arrhythmia. It's a condition in which the upper top chamber of the heart beat in an irregular and fast way. So atrial fibrillation presents with a wide range of manifestations. Some patients come to us with complaints of palpitations. They feel that their heart is racing or beating in an irregular way. Some others complain of chest discomfort, shortness of breath, or even dizziness. Some patients are very unfortunate that we discover atrial fibrillation after they had the devastating outcome of stroke. What's interesting, though, is that a large group of patients with atrial fibrillation are totally asymptomatic. They do not know they have atrial fibrillation while they have it, which puts them at risk of having a stroke without knowing. So multiple risk factors are involved in the occurrence of atrial fibrillation. Age is usually a major risk factor of atrial fibrillation. And as physicians, we're dealing with continuously aging population, so we are expecting the incidence and the prevalence of atrial fibrillation to increase in the society. And with stroke being a devastating outcome that's related to atrial fibrillation, I believe this condition deserves our attention and continuous treatment. The Watchman device is this umbrella-shaped device that we place from the groin in one particular chamber of the heart called the left atrium in an area called the left atrial appendage. Blood does not move very well in the left atrial appendage in atrial fibrillation, and this is where the clots form and cause strokes, basically. So the device functions as a plug that occludes that area and protects patients from stroke. So the Watchman device is indicated in a particular group of atrial fibrillation patients who need to be on a blood thinner to get protected from strokes, but at the same time, they're struggling while on the blood thinner. They are at risk of falling, injuring themselves while they're on the blood thinner, or they're having multiple bleeding events related to the blood thinners. This is where the Watchman device comes in and represents this innovative solution that allows us to get patients off the blood thinner safely while protecting them from strokes. So the Watchman device is placed in a minimally invasive procedure. The patient comes in the morning, they go under anesthesia. We create a hole in the vein in the groin, and we use that hole to advance our tools to the heart. We place the device where it needs to be placed, we deploy and come out, and the patient ends with one suture in their groin, usually, that gets taken out a few hours later, and the patient is able to leave the hospital on the same day. So with the growing popularity of smartwatches, fitness trackers, these days people are becoming more and more aware of cardiac arrhythmias because you can detect them, including atrial fibrillation. What would trigger me to consult with my physician is that if I see that my heart rate is running fast or in an irregular way. These are signs that should raise my concern to pick up the phone, call my doctor's office, and get a consultation. We've had great success here at Genesis placing the Watchman device. We've placed hundreds of these devices so far. Our team consists of interventional cardiologists, heart rhythm doctors, imagists, anesthesia doctors, and representatives from the company that manufactures the device. All this expertise come together to help us successfully and safely place these devices and allow us to provide our patients with a healthier, better lifestyle without stroke.